Welcome. My name is Christoph Marcin. I'm a dermatologist in Stockholm, Sweden. I'd like to share with you some examples of how I assess and treat patients in my clinic to maximize the treatment outcome. Ami is bothered by the volume loss in her cheeks. She's also noticed some unevenness in her upper lip, which she wants us to correct. Given that she has good skin quality but poor tissue coverage, this leads me to the use of products from the Restore portfolio, which are adapted to this type of patient. I start by carefully disinfecting the entire face after having it washed and all the makeup removed. This is particularly important when working with microcannula as you cover a larger area. Now I choose to inject Ami's cheek with the cannula due to the vicinity of the facial artery. If you only aim at the lateral enhancement, a lateral augmentation of the cheek, you might as well use a sharp needle for that. My preferred entry point is on a line through the teardrop towards the lower border of the zygoma. I simply pierce through the skin to create an entry point for my cannula. And with the Restylane volume, I prefer 25G cannula as it's easy to maneuver but still small enough to be comfortable for the patient. I like to lift the superficial fat pad and then carefully rolling the cannula through this mass into the deep cheek fat pad. Once you touch bone, you simply turn around, always making sure you do not point your cannula towards the infraorbital foramen. Once you've reached the deep medial cheek fat pad, you start slowly inject small quantities of the product and watch the tissue as it lifts. By injecting in this area, you achieve both the reduction of the nasolabial fold as well as the tear trough. I keep on injecting as I retract the cannula, making sure that treatment causes minimal discomfort for the patient. Once I've filled this space sufficiently, I turn around the cannula and I check the bolus on the zygoma to create an apex for Ami's cheek. I then finish by backing off, changing direction into the pre-zygomatic space. I lift the malar fat pad to facilitate maneuvering my cannula into this area, and as soon as I feel no resistance, I know that I'm supraperiosteal. Again, I slowly inject product into this area, watching the tissue elevate and disperse it evenly to create a natural looking cheek. Next, I'm going to correct the unevenness in Ami's upper lip. But before I do that, I use a little bit of the product to inject the remaining nasolabial fold. In patients with thick dermis, the Restylane Nasher products offer great lifting capacity and with that great value per syringe. I go along the red of the lip and inject small quantities as I retract. The goal here is simply to even out the difference in fullness rather than changing the look of her lips. A low extrusion force guarantees for an even distribution of the product. Smile, open mouth. Looks good to me. Let's go on with the next treatment area. The next step is to hide the beginning jowl by injecting the pre-jowl sulcus. When doing so, you have to be careful not to widen the chin too much, not to masculinize the look of your patient. I pierce through the skin and then I go on with the microcannula fanning Restylane into the pre-jowl sulcus, giving it a smooth transition from the posterior aspect of the mandible. When injecting this area superficially, there is no need to use a cannula. It's just more convenient for the patient, and also I find this area bruises easily. Here we go, a little massage, and we continue with the mandibular angle to pull back the tissue and to create a nice and elegant mandible for Emmy. When injecting this area, make sure that the cannula will not touch the earlobe. Roll your cannula in a superficial plane along the lower angle of the mandible until the mandibular ligament, and then inject slowly as you retract. This way you create support all the way around the mandibular angle, helping to pull back the tissue, and together with the injection of the interior aspect of the mandible creates a more elongated look and a very nice profile for your patient. The next step in the restoration of Emmy's face is to provide support for the tissue by injecting Restylane along the mandibular angle. I start by piercing through the skin. The injection will be done rather superficially on top of this mass to avoid any injection into the parotid gland or interaction with the facial artery. The first step is to insert the cannula and go along the posterior aspect of the mandible. This is an area where we have a lot of ligaments. The most convenient way to pass them by is to just roll your cannula through. Make sure you're still in a rather superficial plane. This is the plane of the temporal lateral cheek fat pad, which is widely lost in Emmy's face, and then with low pressure and low extrusion force, I inject some Restylane into this area. I smooth the product with my finger, making sure I have an even distribution. This is a treatment indication and a treatment area that will require slightly larger volumes. So far I've injected half a cc of Restylane, and I will use the rest of that syringe to inject along the lower aspect of the mandible and pull back the tissue as far as possible. And it's careful to keep in mind not to inject too much onto the lateral aspect of the mandible, as this would widen her face and make it look more masculine. For a finishing touch, I will elevate the lateral aspect of Emmy's brow using Restylane and a cannula underneath the orbicularis oculi muscle. I slowly forward the needle as I inject and watch the tissue lift. Very small quantities go a long way in this area, and I aim at injecting from the frontal ridge along the outer orbital rim until the upper border of the zygoma. If you have a patient with thin tissue coverage, you would of course benefit from using a product from the Restylane OBT range. I've injected around 0.1 cc in this area, and I now mold the gel along the orbital rim to provide support for the eyelid and also smooth out the crow's feet with this technique. For the correction of the volume loss in Emmy's face, I've been using 1 ml of Restylane volume on each cheek, predominantly on the deep medial cheek fat pad, as well as Restylane into a nasolabial fold for the correction of the symmetry of the upper lip, the pre-jowl sulcus, the mandibular angle, and the lateral aspect of the brow.